Welcome to the Discovery Doc podcast, where we advocate for optimal wellness and reducing everyday toxic loads, no matter where life takes you. I'm Dr. Cece, doctor in nursing practice, self-proclaimed toxin tamer, and a crunchy mama.
I'm Anna Kate, a medical mystery overachiever and your discovery liaison. Join us on this exciting journey as we explore the world of holistic health, cutting-edge research, and practical solutions for a healthier life. Together, we'll navigate through the complexities of wellness, sharing valuable insights and expert advice.
Tune in to the Discovery Doc podcast. Get ready to be inspired, empowered, and discover a whole new way of looking at your health.
Welcome back to the Discovery Doc podcast. I'm here with your host,
Dr. Cece, functional medicine nurse practitioner, self-proclaimed toxin tamer, and crunchy mama, and our co-host.
I'm Anna Kate, your medical mystery overachiever and discovery liaison. And we are back with another mini-sode of a 1-2 punch to those Bash Brothers that we talked about in the last episode. So if you missed that, go back and listen to that. And now we have a solution to bust them up, beat them up, and get them out of town.
Yes. So for these minisodes, we're focusing on topics that you guys wanted to hear about and know about more. And a question that I get asked a lot is, what exactly is SOT? We have mentioned SOT a couple of times throughout this podcast. It's something that is we talk about every single day in my practice, but what it is, what is it used for? All the good things.
Let's see if I can say it.
Go ahead. What does it stand for?
Supportive?
Yeah.
Yes. Got
the first word. You're going to say it wrong, and I can't listen to you say it wrong. It's going to mess me up.
Supportive oligonucleotide therapy.
Okay. It's like we're doing the
ASMR.
Yeah.
I hope I said that
Supportive oligonucleotide therapy.
Oligonucleotide. See, I say it wrong.
Whatever she said, I don't want to know because it'll mess with my brain. SOT for short.
Yes.
So SOT, I will go through a big spiel. So you stop me because this is what I go through with my patients. Stop me when we need to. But before we get into what it is, I think it's important to know why I offer SOT.
Yep.
And there are other clinics who offer it too. It's not just ours. But why we resort to it for certain illnesses is very, very, very important. So one of the illnesses we're referring to is Lyme disease. And Lyme is something that I utilize SOT for nearly every single time. Mm-hmm. There are not many other bacteria or viruses where I'm reliant on an SOT treatment. And again, we'll go through exactly what it means. But when it comes to Lyme, it is my go-to because it is the most efficient at actually eradicating the bacteria. Whereas for something else, like let's say a patient comes to me and we test them and they have Lyme and Bartonella. Bartonella, I'm very comfortable getting started on a protocol of a supplemental and medication regimen and getting that going. And that can be highly effective for a patient where we don't need to rely on an SOT, but I do need an SOT for Lyme. I'm very upfront about that. And it's also a costly treatment. And so I prioritize. Yes. And I say, okay, we have these 3 things going on. I know I need it for Lyme. These other 2 over here, we can get rid of these usually about 95% of the time using just protocols.
Yes.
There is a line in someone's journey where if we tried all the things and conventional and more functional medicine in terms of eradicating certain illnesses or bacterial loads in patients or viral loads in patients, then I always have an SOT for that in my back pocket.
Yes.
But it's usually not my front runner for anything outside of Lyme.
So it is, I'm going to say from my own personal experience, for Lyme specifically, it is more cost effective than the alternative.
Yeah. Yeah.
So, and I went through both of them, and that was the original protocol that I was on was with insurance was thousands of dollars a week out of pocket. A week. Not a month, a week. Thousands of dollars a week. So that when this opportunity that I got introduced to SOT came up and it was like, hey, it is this, it does this, and then we're good to go. And it's like, well, why isn't this an option all the time for Lyme specifically? Yeah. So when I'm just putting that kind of caveat out there too,
It's
that it
true.
does seem like a little bit upfront, but the alternative is, I mean, I probably spent several $100,000 over the course of trying to figure it out
Yeah. Oh
and get
no.
better, and it only made me worse.
Yeah, and that is so normal for by the time patients end up in our lab, they're like, we've spent 50 to $100,000 in conventional medicine, but then also going around the world to Germany and Mexico and all these
Right.
places and spending thousands and thousands of dollars per week. So when you put it in that perspective, yes, it's a minimal amount. But if I happen to be someone's first stop in their shop, which I love when that
Yeah.
happens, to that person, it can sound a lot, especially if we're used to insurance being able to cover things because insurance does not cover
Right.
SOT. However, good health shares do, which
Yep.
is amazing. So more on the medical side of why we utilize it is go back and listen to our last mini-sode of kind of what Bartonella and Lyme and symptoms
Mm-hmm.
entail to get a little bit more detail. But Lyme, because it's shaped like that spirochete, because it's shaped like that corkscrew, it adapts very easily and it hides and can morph very easily. And so if we have a chronic infection of Lyme and we're taking oral antibiotics or we're taking herbs or whatever, there are these big molecular structures that are meant to try to kill that Lyme bacteria. Eventually that little spirochete is going to be like, nah, bro, I don't want to die.
Yep.
I'm going to go over here
Let's
and
go play
dig.
hide and seek.
Yes, let's play hide and seek. I'm going to go hide where I'm safe,
And they're really good at it.
where there's lack of blood flow, where that antibiotic or herb is not touching me. And so now that patient, that person might feel better on the antibiotic. They might feel better on the herbal protocol, or they could go the opposite way and hurts like crazy. But as soon as we stop taking that antibiotic, and sometimes it's IV. There's patients who have PICC lines because of IVs.
Yep.
They're on cyclical antibiotics for months and months and months. And what are we doing? We're suppressing that bacteria. So if I took your lab, if I took your blood work while you're on that antibiotic, that test would look better.
Mm-hmm.
Why? Because those things are not freely flowing in the blood. Why? Because your immune system is now not attacking it, which means my symptoms will calm down. But when we stop that antibiotic or stop that herb, now all of those little spirochetes that have been replicating where they're safe come back into the bloodstream. Usually I'll see about 2 to 3 weeks, depending on how long the course of antibiotics have been. About 2 to 3 weeks later, patients will start to tank again.
Yep.
And what do? Get back on the
antibiotics.
yes.
Yeah. So that was a good point, that they don't only replicate in your bloodstream. When they go and hide, there's 2 of them in a room and it's like bunnies. So it's not that they have to be in your bloodstream to replicate. It's
their natural sequence of life.
Right.
At the end of that bacteria's life cycle, it replicates. So that doesn't matter when you have an anaerobic bacteria or a bacteria that doesn't need oxygen to survive. It doesn't matter where it is to replicate. So yes, they continue to replicate and continue to cause havoc. And at the end of the day, they're just not being killed. And so then you get off that antibiotic and they come back into the bloodstream, and then the patient tanks. And so that's why when you have somebody who has chronic Lyme or we've diagnosed it and it's on that IgG side, it's on that chronic side, I don't mess with herbs or antibiotics. I go right to an SOT because I don't want to waste time at that point, and they're not efficient at truly eradicating that bacteria. Now, if for whatever reason you know that you are exposed to Lyme and you get on doxycycline right away, let's say that you truly were bit by a tick and bullseye rash, we know that it's Lyme, you get on an antibiotic, you get on doxycycline, it is very effective in that moment.
Yes.
Very effective. But once you cross into the chronic category, that is what I'm speaking of, is where clinically I do not see it eradicating chronic Lyme ever.
Yeah. Chronic antibiotics is not a solution.
Right. Just further destruction usually.
Right.
But I do respect patients' journeys. And I've had patients in the past who have to go that conventional route and have to do that first, where they're like, I don't know about this. Like, can you either prescribe me long-term doxycycline, or I went to my PCP and I'm going to do doxycycline with them and then see what happens. I'm like, okay, great. Here are my stipulations. Go do that. Everybody has their own process. Go do that. Do not retest your blood while you're on the antibiotic. Get off the antibiotic, allow your body at least 2 weeks, then retest your blood work, and I'll most likely see you back every time I see them back. But it's just a matter of, I understand it's a very unconventional treatment, and so people have to go through their process to want it or to want to explore it.
Right.
Or they need proof that antibiotics won't work or something like that. So
that's really expensive to go that way. I know, because I've gone that way.
It is, if it's long term, for sure. So then we get to, I just love my patients understand why I go to an SOT for Lyme. That's very important for me. It's not a money grab. It's not something, and if it was, I would be one of these clinics that if you came to me and you have Bartonella, Babesia, and Lyme, I'd say, hey, we need an SOT for all three. You know, that's not us, but I do absolutely need it to eradicate Lyme. So that brings us to, okay, what the heck is SOT? And SOT is, in essence, antisense therapy. So antisense therapy has been around in the United States for a very long time, since the 90s. And we utilize a very similar technique in terms of antisense therapy for hepatitis C in the United States. And it's just that we don't utilize that technique for anything else. And so we go to a company who has been doing SOT. SOT, it's just their name for antisense therapy, so they coined it in like 2004. But we go to a different company, and they have been doing SOT since 2004 clinically. And what it does is you send the patient's blood to that lab. The lab is looking at you have to have a positive Lyme test to do so. You can't just send random people's blood. Random people's blood. But what the lab is looking at in that patient's blood is that Lyme bacteria. So they're taking that Lyme bacteria and they're dissecting the genetic sequence that's responsible for cell replication within that bacteria's DNA. So not yours, they're not touching anything about you, but they are seeing, okay, what is the genetic sequence responsible for keeping that Lyme cell replicating in this patient? And they are making an antisense copy of that, which is like a reverse copy. Flipperoonie. They multiply that up to 1 billion times, freeze dry it down, send it back to the clinic. And that whole process takes about 4 weeks. When we get it in the office, it looks like it's this little tiny tube that has a little teardrop at the bottom of it, not some like weird bloodborne product. People picture all sorts of things. And when we get it and we notify the patient that it's there, we go to infuse it with normal saline and sterile water. So in the infusion process, there's no antibiotics, there's no synthetic ingredients, nothing. It's those antisense molecules, which are our fancy oligonucleotides, very, very tiny small cells, and water. In the history of SOT, there has never been, in terms of implementing it clinically, there's never been an adverse reaction to the infusion itself. Say that for an antibiotic or even an herb. So it's extremely, extremely safe. And that's the literature behind the company. I mean, spans 30 years prior to when they were even doing it clinically. So the point of those oligonucleotides, when they enter the bloodstream, they are attracted to Lyme like a magnet. Genetically, they can't fit to anything else. They can't. They go through your cells like light through a window. They can't attach. So they're identifying those Lyme cells because they're genetically made from them, permeating the cell wall, getting inside.
Biofilm is a big...
People love to harp on biofilm. It doesn't matter. It doesn't matter because these oligonucleotides are the tiniest cells known to mankind. So they can permeate biofilm.
So that's what I'm saying, is that antibiotics and other herbs and things can't go through that biofilm.
They're too big.
So that's why this one is so important to...
to differentiate. Sorry. No, absolutely. Because I get that question a lot. It doesn't matter because that cell is so darn tiny and it's not foreign to the Lyme cell. And so it's able to permeate that cell wall or get through that biofilm and attach to the receptor that it was made from, which is for cell replication. So when that cell goes to replicate at the end of its life cycle, when it goes to replicate, it can't. Because that oligonucleotide, that little tiny cell, is in the way, blocking that replication sequence. So it induces cell death from the inside out, which is dramatically different when you have an antibiotic or an herb that is attacking that cell from the outside. That is when the Lyme spirochete is like, no, I'm going to morph, I'm going to adapt, I'm going to go hide, I'm moving over here. In very layman's terms, obviously. But the SOT molecule It's not foreign to that Lyme cell.
Yeah, I like you.
Yeah, like you're part of me. You belong here. So it lets it in, it hangs out, and now it induces cell apoptosis or cell death from the inside out. And it looks like it turns it off. It turns off the light switch.
Yep.
And it looks like a natural death then to our immune system, but also then to the bacteria. And so there is no Herx reaction. People obsess also about Herxheimer reactions. It's not possible with SOT because there's no immune interaction.
Right.
My immune system is not seeing this big war like it can happen with herbs and antibiotics and go attack over there to try to protect me. It doesn't see anything.
Right. Okay, so I'm going to sum this up into layman's
Ooh, I'm excited to hear
cheese
this.
brain terms. Okay, so we're going to take our blood and pull out the antisense of my specific brand of spirochete viral virus, right?
We're talking about bacteria.
Bacteria. Yeah, that too.
I'm going to give her another chance.
Okay.
Start over.
See, cheese brain. So we're taking a sample of my specific bacteria,
Mhm.
and we're sending it off and having the antisense done and getting it down to all the little kill switches, all the little
Yes,
all the little
all your little specific kill switches.
Yep. So
Yep.
when it comes back and it gets put into me with,
Or you know what, I would say turn off switches, because kill switches still can make people feel like there's going to be some big Herx reaction.
Right.
I would say little turn off switches. Yes.
Okay, so they come back in and turn off lights. So
Yes.
Here's another way to think about it is, you know, when you've had that like a pump that has the little clip on it so that you can travel with it and it doesn't depress in your bag, that's what's going on to the light switch, is a block that you cannot flip the switch.
Yeah, forever.
Yeah. Yeah. So the spirochete life cycle is 90 days, right? So when that SOT gets put back into me, that, like the moment before the antisense goes back in, the SOT goes in, the last spirochete that was born, there no more will be born after that 90 days after that. So the youngest spirochete that was born right before we put the SOT back in is the youngest.
Yes, but no, I'm going to debunk that a little bit, because you're infusing billions of these oligonucleotides, right? But it still takes time to identify all those Lyme spirochetes to turn them off.
Okay.
And so they're in that time that it takes for those oligonucleotides to find those Lyme cells, they can still be replicating. But that is why SOT lasts for 6 months in the body.
Right.
Because the life cycle, like you said, of Lyme is 90 days. So we're covering multiple life cycles of Lyme. So it doesn't matter if they're in there still replicating.
Right.
That SOT lasts long enough to turn off even those baby cells, quote, once they're grown. So that is, that's the second half of that is, and a very important part is that SOT is in there for 6 months doing its job.
Right.
And so if we back up just a tad, there is no possibility to Herx, not at all, because you don't have an immune response to it. But what I like to differentiate and say is that after infusion, when those light switches start to turn off, so it is truly eradicating the bacteria. It's not just like putting this little coat on the bacteria and it's floating around now in your blood, but it just can't turn on. That's not it. It truly is when cells can't replicate, they die. And so it is truly inducing cell apoptosis or cell death. And so what I will see is, as that's occurring, our immune system is like, oh, this feels good. I like this. I'm turning on. I am now going to target you, and you. All these things that you couldn't target initially because you were more immunosuppressed from that Lyme bacteria. So our immune system starts to turn on. And when it does so, I will see sometimes an influx in symptoms anywhere between the 2 and the 8-week mark post-SOT. And it's not an adverse reaction from the SOT itself. It's not a Herxheimer reaction from SOT itself, but rather your immune system turning on and targeting other things that it couldn't before, which is wonderful. But that's why I'm very specific and strategic, and why not all SOT clinics are created equally is because timing matters. Timing is of such the essence. What you're doing before SOT, what you're doing after SOT, what you're testing after SOT, when you're testing it. I don't just let the patient go for the next 6 months and then see them at the end of it. And I also think that good practitioners who are doing it will always give you apples to apples, will always test you for Lyme at the 6-month mark, because if you do it any earlier, it's ridiculous. It just, you want to know its full effectiveness, but not leave you hanging for that full 6 months.
And managing expectations, because if you don't know that, hey, you've got these other bacterial and viral loads happening in your system, and when your immune system wakes up, then you may feel worse based on those things and those symptoms, but it's not the Lyme. So I mean it's not the SOT having an effect, a negative effect in that way, because I think that for a long time people thought, oh, well, I'm going to get SOT and just feel better.
It's the end all to be all.
And it's not.
No,
it's not. It's the end all to Lyme.
Yes.
But especially taking me into account and consideration, I have 18 other co-infections that still act like all of this. So I did notice I felt better but different.
Exactly.
And that's what I had to go with. And she totally helped me manage that expectation of, it's not like I have a cold and the flu and then I don't have it. It's not that night and day kind of, all my symptoms went away because I had all the others. And now I'm 5 years post SOT, 4 years post SOT, and I still have joint symptoms and other things, but that's because of the other things that I have, not because I'm still suffering from Lyme.
It can
totally turn Lyme off.
Yeah, it can be very, like, and completely different perspective. I didn't have all those other things. I had some things turn on afterwards, like 6 months later. But for me, it was very cut and dry, where 2 weeks after having SOT, I was like, holy moly, what is this? I have energy. My brain's awake. My joints aren't hurting. My joints aren't locking. Like, what is going on? This is amazing. And that kept progressing for me. That didn't stop. And so if someone truly just has Lyme and nothing else going on, then that story can look very different.
Yes.
My patient population, that is not the case. There are just so many other things going on that SOT is a wonderful tool. And I always set this expectation. It is a necessary tool to eradicate Lyme, but it is not the end all to be all when someone has multiple things going on. That practitioner has got to know timing, has got to know what to look for, has got to know what could activate post-SOT. And that is then when you see it thriving and working really well. And I do think, going back to these like online communities, you get in some of these SOT communities and it's a bunch of trash because the people are just being given it by these SOT clinics and not having the care around it.
Not managed correctly.
Yes, and it's not managed correctly. When it's managed correctly, it is the most wonderful tool at eradicating Lyme, but you have to know what you're doing.
So it turns the Lyme off. It doesn't, there's still, after that happens and we make sure that that's all good and hunky-dunky, that there's the repair and restoration process that has to happen next. And if you just do the first part and you don't address the repair and restoration, you can still feel like snot.
Because what we were talking about earlier is like when that spirochete, when it digs, it can literally cause physical damage to your cartilage, causing joint pain, causing inflammation. So yes, SOT will eradicate that bacteria and take it away, but it does not magically fix that damage that was done. And so that's also where you have to be very careful with talking to other people about this treatment, is if it's not managed properly with all the other things that go around it that we've said, and you haven't then been put through a proper healing protocol post SOT, then you'll never have the quote positive benefit or success story that someone else might have that was given that opportunity from a practitioner. So
so the SOT keeps the screws from making holes, but once they're not making holes anymore, you do have to go back and fill those holes.
Exactly. So that is SOT in a nutshell. SOT can be made for, it's a very specific treatment. So when I order it, I say, hey, this person has Lyme. Here's the test. This is what I want the SOT for. But it's not only a Lyme treatment. It's SOT, I want to make sure everyone understands, is the scientific technique. And that scientific technique can be utilized for a multitude of viruses and bacteria, not just Lyme. It's just that in my clinical experience, I need it for Lyme
Mm-hmm.
and I don't usually need it for other things, although it's really great to have in my back pocket
Right.
with those patients who I have had to need it for, but it's not usually my go-to up front because there's so much else that can be done in the meantime. Until I get to the point where I'm like, hey, we need an SOT for this Bartonella or the Epstein-Barr virus or whatever
And
it
I've
is.
gotten too, because my body was so overloaded with all
Yeah.
the things that that was a solution to give my body time to kind of catch up if we turn both of those things off.
Right. Oh, and that's the last good point is that this isn't an infusion that you get every 6 months.
No.
That's not the point. In no world. When I look at labs, I can usually decipher up front if someone's going to need one or two for the same strain of whatever it might be. So let's say Lyme. Most of my patients only need one infusion for Lyme.
Yeah.
And then we check 6 months later and it's gone. We're working on other things for a longer time. We're healing for other things for a longer time, etc. But the Lyme aspect, one and done. There are some patients who have had to give 2 Lyme. I was someone who needed 2 Lyme SOTs, but that was on me because I didn't do the proper follow up. But I have not had to do more than 2 specifically. So it is not for that bacteria. So it is not something that's recurring. It is something that should be eradicating that bacteria. Another question I get a lot is that it doesn't protect you from the future.
Mm-mm.
So it'll take away what's there, but it is not going to magically protect you from possibly being re-exposed in the future. So I think that's also a realistic expectation to mention.
Yeah, I think if you have Lyme disease, Borrelia burgdorferi, it is the end all be all to turn that off. So that's in my professional opinion, that's what I would. And that's what because I went through it, I experienced it, and I experienced it on both sides too. So I come from that experience of doing it the traditional way and that not working. And it's very frustrating on that side too, because you get on the antibiotics and you feel better and you get this false hope that something's happening and then you take. So I went through 6 or 7 years of going up and down and just destroying my system.
Yeah.
So it gets my personal stamp of approval to turn that off.
Yeah.
So.
No, absolutely. Mine too. Mine was similar, just not antibiotics. It was herbs. I went through, hundreds and hundreds and hundreds of protocols and herbs. I did do antibiotics, but a very short amount of time, but it was more so the thinking that I needed 50 capsules in a day to sustain and doing all these crazy herbal protocols until finally I came across SOT and did it. And that was that. It was a wrap.
No, that's all she wrote.
That's all she wrote.
And it is the hope. It is the great white hope.
How cheesy.
It is. And it sounds so from this side of experiencing it, it sounds like, oh, well, why just wouldn't you do that? But no one ever talks about it.
Right.
So if I had known that this was a solution, I probably would have done my research back in the back. But then I would have been like, okay, well, and then I got to the place where I was so desperate. I'm like, I will do anything.
Yeah.
So I will stand on my head in the rain with my pinky out to the side at 90 degrees if I can get this to go away. Because it's a very disheartening place to be when you will do anything. And that's where it costs a lot of money, is doing all the tinctures and all the herbs and I did hyperbaric for like a year and a half. I went to work so I could pay for hyperbaric.
Yeah.
And it was a great nap and lots of good oxygen, but it didn't do anything for what I was dealing with. It was great. And it's a great therapy, but not for what I was dealing with.
I find that a lot, like ozone and hyperbaric. All these things are great as modalities, sometimes as healing modalities, sometimes more in acute situations, but you are not going to put somebody in a hyperbaric chamber and eradicate their Lyme disease. You could help them heal after it's gone 100%, but it's not going to eradicate it. Just
Right.
like I don't believe ozone eradicates it,
Right.
because unless you drain every single piece of blood, every
Yes.
single ounce of blood from your body, as well as every ounce of cartilage, and possibly the lining of organs,
Just a whole body
and
transplant.
right,
That's not a thing.
and then ozonate it and put it back, then I don't see it eradicating Lyme either. So that's a great point. Is a lot of those are great modalities, but the proof is just not there to actually eradicate the bacteria and not just suppress it.
Yep. So this mini-sode was a little bit longer, but
it
was a big one. We had a lot to talk about. So if you have questions on this, if you would like us to discuss this further, please drop a note below or send us on our website at thediscoverydoc.com/podcast. You can ask us a question all about it. And if you want to learn more on the doctor side, reach out to Discovery Wellness and get connected there. So wherever you are.
Yes. Until next time, let's discover together.
We hope you've enjoyed this journey of exploration and learning as much as we have. Before you go, we have a special request for you, our beloved discoverers. We'd be thrilled if you could show your support in a few easy steps. Step 1, if you're watching on YouTube, please hit that like button and subscribe to our channel. Don't forget to ring that notification bell so you never miss a moment of discovery. Step 2, if you're listening via Apple Podcasts, please take a moment to rate and review our show. Your feedback means the world to us and helps others discover our podcast too. Step 3, whether you're on YouTube or listening on your favorite podcast platform, please share the Discovery Doc podcast with your friends, family, and social networks. It's the best way to spread the joy of discovery. And finally, don't forget to follow us on social media. You can find us on Instagram, Facebook, and TikTok at The Discovery Doc. Stay connected with us for updates, behind-the-scenes content, and so much more. Plus, for exclusive content and additional resources, be sure to check out our website at www.thediscoverydoc.com. And while you're there, if you have a burning question or a topic you'd like us to discuss on the show, simply let us know. Thank you, Discoverers, for being part of our incredible journey. Until next time, let's discover together.
The content provided in this podcast provides general information and discussions on various topics related to health, wellness, and medical advancements. However, it is essential to understand that the content provided in this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The hosts, guests, and contributors are individuals sharing their personal experiences, opinions, and knowledge in their respective fields. While they strive to provide accurate, up-to-date information, medical knowledge is constantly evolving, and the information presented in this podcast may not always reflect the most current research and medical guidelines. It is crucial to consult with a qualified healthcare professional or medical expert for specific medical concerns. Never disregard professional medical advice or delay seeking medical treatment based on the information presented in this podcast. The Discovery Doc podcast encourages listeners to use their own judgment and discretion while implementing any suggestions, recommendations, or lifestyle changes discussed in this episode. Each individual's medical situation is unique and may work for one, may not be suitable or safe for another. The podcast hosts, guests, and contributors are not liable for any direct, indirect, consequential, or incidental damages or harm that may arise from listening or acting upon the information provided in this podcast. Listeners are responsible for their own health decisions and should exercise caution and seek professional guidance when necessary. By listening to this podcast, you acknowledge that you have read, understood, and agreed to this medical disclaimer. If you have any questions or concerns about this medical disclaimer, please consult a qualified healthcare professional.